Good morning, everybody. Happy Tuesday, and welcome to our Small Business Resource Series during all of this COVID-19 time. And every day we are reaching out to different experts in the community on a different topic that you guys have kind of asked us about or reached out to us on. So here at the Albuquerque Hispano Chamber, the first thing we want to do is say thank you to our partners at Square Inc. We appreciate you guys, Aaron, Ahmed, and the whole team out in the Bay. We hope that you guys are keeping safe. We also want to say thank you to our partners at New Mexico Tech. Today, as always, Liam is helping us troubleshoot as we get used to the new technology that has become the normal for most people. So I want to say thank you to them. And I also want to remind everybody that we have a survey that is floating out and about there in the world. And that's kind of how this whole series got started, was with the survey and you guys telling us what you're needing at this time. So we've covered all kinds of topics, from the unemployment series to Department of Workforce Solutions, the PPP. As a matter of fact, Jamie, who's going to be speaking here in just a minute, was with us last week. We also talked about the SBA Disaster Loan Fund. We even talked about the hospitality and tourism industry. So we've had a really busy couple of weeks, and so we're super excited about sharing all of this with you. So today, we want to make sure that you are still using that survey, and you can find that on our website at www.ahcnm.org. It's also in our weekly newsletter. So if you are not a member of receiving that weekly newsletter, you can go to our website, and also at the very bottom of the front page, scroll down, populate your name in there so you can start getting that newsletter. And you can also find it pinned to the top of our Facebook page here, where this is going live right now. And all you do is click in. It's 5 questions, 5 minutes. We would really appreciate your guys' feedback. It's so simple, and we really use the information to bring to you guys the info you need. So one of those topics that came up was HR and human resources and the human resources department, and what businesses are going through right now during COVID, and maybe even after and before COVID. And are you HR ready? Are you in the right space? Let's do a little health check today on your HR department. So we reached out to some of the experts in the community, and I'm gonna let them introduce themselves. But I just wanted to say thank you to our panelists, Jean and Jamie. So Jamie, if you will start, let us know who you are.
Absolutely. So my name is Jamie Allen. I'm an attorney with Module Sperling, and among other things, one of my main areas of work is employment and HR issues. So really glad to be here today.
Thank you, Jamie. Jean?
Good morning. My name is Gene Bermudez. I'm with Valiant Consulting. Been with them for about a year now, but prior to that was with New Mexico Gas Company, Public Service Company, Loveless Health Systems. So a lot of time here in the local community in the HR world.
Great, thank you guys so much. We're excited because there's a couple of people that have asked, you know, we have businesses in the Albuquerque Hispano Chamber. We have about a little over 1,000 businesses. Small businesses, one owner, they work out of their, garage kind of thing, all the way up to the corporate side. But right in the middle, we have that little sweet spot of businesses that are less than 10. And so what we want to talk about today is some of the businesses that have, a couple of employees. What do they need to be healthy in their HR department? First and foremost, I think that's super important. It's important also because there's going to be employees watching, not just employers watching on this series. And then I want to kind of dive into how does that change during this last month and then upcoming months with COVID. So we'll start with you, Jamie.
Great. So I'm glad you mentioned both employers and employees. So what I'm talking about today is the benefits and obligations of employers and employees during this time. Namely the Families First Coronavirus Response Act, which was passed mid-March, but just went into effect on April 2nd. And this act includes 2 main sub-acts, I guess you could call them. Those are the Emergency Family and Medical Leave Expansion Act, as well as the Emergency Paid Sick Leave Act. And I'm going to go over the Emergency Family and Medical Leave Expansion Act first. And as I said, this went into effect April 2nd and will be effective until December 31st of this year. So overview is basically this act allows employees to use FML leave related to a public health emergency. And for the purposes of this act is defined as an emergency with respect to COVID-19 declared by a federal, state, or local authority, for absences related to childcare. So basically, if you are a covered employer, which we'll get into who's covered, who's not in just a second, but if you are a covered employer, you are required to provide up to 12 weeks of FMLA leave for covered employees. And a quick aside, we'll say the covered employers are a lot of those which you explained are kind of in that little sweet spot. It's private sector employers with fewer than 500 workers. And this applies to governmental entities as well. But for our purposes, we'll say these small businesses, less than 500 workers. And covered employees are people that have been on the job for at least 30 calendar days, and they are unable to either work or telework because they have to care for a minor child because either that child's school or daycare or thing like that has been closed, or the child care provider that they usually go to is unavailable also due to COVID-19. And I'm going to add the little caveat that an employer of an employee who is a healthcare provider or an emergency responder can elect to exclude that employee from the application of this section just based on the dangers of their job. So, okay, we have a covered employee, we have a covered employer. So what are the requirements? Like I said, up to 12 weeks FMLA leave. First 10 days are unpaid. After that first 10 days are exhausted, employers are required to provide paid leave, and that amount is to be calculated based on the employee's regular rate of pay, as well as the number of hours that employee would otherwise normally be scheduled to work. And there's two little catches here. The first is, as to that first 10 days of FML leave that's unpaid, employers can, but they're not required to, substitute either accrued vacation, personal leave, or sick leave for the unpaid leave. And so again, that's elective. The employer can choose to do that, but they don't have to. And the second catch applies to the 10 days, after those first 10 days are exhausted. The 12 weeks after that, the amount that the employee can receive is capped at $200 a day and $10,000 in the aggregate. Next thing that I want to cover in relation to the Families First. Okay, what is the name of this again? It is so long. We change it every time. Families First. Coronavirus.
It's a long name. We need all of that.
And then we include all these other names within it. It's all over the place.
They can't make anything easy these days.
No. But so the second act within the Response Act is the Emergency Paid Sick Leave Act, and this is the same time frame. It went into effect April 2nd and is effective until December 31st. And the main point here is that it permits employees to use sick leave related to coronavirus, but again, there are some, some specific requirements. So first we'll go over the covered employer, covered employee. Covered employer is the same as for the FMLA leave. It's private sector employers with fewer than 500 workers, so most of the chamber's members and, a lot of small businesses in New Mexico to begin with. So private sector employers, less than 500 workers. And the covered employee is all employees in this case. And time employed does not matter for the purposes of the Emergency Paid Sick Leave Act. But the same caveat does apply as far as an employer of an employee who is a healthcare provider or a first responder can elect to exclude that employee from the application of it. So requirements. You have the covered employer, covered employee. What's the deal? Requirement. That employer must provide each employee paid sick time to the extent that that employee is unable to work or telework and has a need for leave because they meet one of these 6 requirements. And I am going to screen share this. I've been having issues with screen share. Oh, we can't today. That's okay. It's telling me the host is disabled, but that's okay.
I can make you host real quick.
Okay.
Give me 1 second.
That is our voice of somewhere out there in the world. Thank you again to New Mexico Tech and Liam for stepping in on helping us out. It's so amazing. I don't know what we're going to do without you guys. I feel like we need to be forever indebted to do this through New Mexico Tech. Thank you, Liam.
Yes, thank you, Liam. So much easier. So,
Ooh, very nice.
if we're looking right, I don't know if you can see my mouse moving, but these 6 requirements here. If the employee is to get the paid sick leave under this act, they need to meet one of these requirements. Either that employee is subject to a federal, state, or local quarantine or isolation due to the virus. They have been advised by a healthcare provider to self-quarantine because maybe they have symptoms, or maybe they've traveled or things like that. If they've been told to quarantine by a healthcare provider, they will come under this provision. If the employee is experiencing symptoms of the virus and medical diagnosis, maybe they're waiting on a test. The employee is caring for an individual who is subject to an order described in any of the 3 things above. So your employee is taking care of someone that has symptoms, they're waiting on a test, this will still apply to them. Next is the employee caring for a son or daughter. It's similar to the FMLA Act, is if they're having to take care of that child because the school or the child care provider is unavailable, they will also come under this act. And finally, if the employee is experiencing any other substantially similar conditions specified by Secretary of Health, Human Services in consultation. So that one is kind of a catch-all, but main points are if your employee or someone they're taking care of or their child is experiencing symptoms, they're quarantined, all these will bring that employee under the act, and the employer will have to pay that sick leave for this time. And important down here for employers is employers must post a notice related to this section somewhere conspicuous in the workplace, just so employees are aware that this is available to them. It's really good to have this notice up, and the Department of Labor has provided a model notice that you can get on their site as well.
Okay.
I think I have turned my screen share off, but here we go. Now there is also caps on the Emergency Paid Sick Leave Act, similar to the act applying to FMLA. Under the Emergency Paid Sick Leave Act, for full-time employees, this will cover 80 hours. So 80 hours for full-time. For part-time employees, it is, quote, a number equal to the number of hours that such employee works on average over a 2-week period. So basically, if they're part-time, average out their 2-week period, that's going to be how many hours they're getting.
Okay.
This is also subject to a slightly different amount cap, but it is capped at $500 a day, and so it's higher for the daily, but lower in the aggregate. It'll pay up to $5,110 I'm sorry. So the requirements that we shared a little while ago, and I will screen share that one more time. For these requirements here, your cap is going to be just a little different. Sorry about that. Okay, here we go. So numbers 1, 2, 3, and 4, these first 4 bubbles, the cap will be your $500 a day, $5,110 per week. For the remaining points, the cap will go back to your $200 a day and $2,000 for the aggregate. So you have to be careful as to what employee is claiming sick leave under which provision, because their amount will be capped differently. And the other important point is that paid sick leave given under the Emergency Paid Sick Leave Act is not going to carry over from one year to the next. So that's important to know. And one final thing, there are just so many different resources, so many different things that is available right now. And I thought I would share some additional resources because there's just so much to cover that we're not going to do it in 30 minutes or an hour or a couple hours. So first I have on here is what you should know about COVID-19. This is from the EEOC. They've put out a little handy fact sheet for requirements, common questions regarding the Americans with Disabilities Act, the Rehabilitation Act, and other EEO laws. For example, what can I ask an employee who's calling in sick? You know, is it within my rights to ask if they are exhibiting symptoms of COVID-19? Am I not? So that's a really handy fact sheet. I really recommend that all employers kind of check this one out, give it a read. Another one, I'm sure it's been passed around quite a bit, is just the CDC interim guidance for businesses, employers to plan and respond to COVID-19. That one is available on the CDC site and has been widely disseminated. And finally, the Department of Labor has put out an OSHA guidance for workplace safety during COVID-19. So that will cover just how to keep your employees safe when they're on the job, especially with respect to COVID-19, because as you guys know, this has all changed just so much as far as how we handle ourselves in the workplace, what's safe to do, what's not. So that guidance is really handy. And one final point that I'll put out there, especially from the legal perspective, is there's kind of risk everywhere with this that is unknown, and we don't know the amount of risk that people and businesses are susceptible to during this. You know, if one employee catches COVID, God forbid, and brings it back to the workplace, what's possible liability? Is there any? So I'm going to punt on this one, and I'm going to say, please talk to your attorney. And of course, at Modular Sperling, we have quite a few lawyers that can help assess that. But really, as long as if you are getting the right resources, just please talk to your attorney, whoever that may be, and make sure you're assessing that risk that might be coming up.
Thank you, Jamie. That's a lot of info. I'd like to ask you if you can, later on, if you can share that document that you had, because I think that a couple of things that I know for sure before we get to Jean, and it's something for Jean to think about, is there's a lot of people that probably didn't have any sort of HR plan in place when this happened. We know that people are like, oh my gosh, now what do I do? So that's one of the reasons that we want to tell them it's okay. Let's figure this out moving forward, and here's some options for you. So that's why your document would be really, really helpful. But Jean, if you could, we could start with you. I want to just go back to basics for a minute. For those small businesses out there that really don't have a plan in place, and they really have not figured out how they're dealing with their 3 or 5 or 7 employees, tell us a little bit about what traditionally is FMLA and what it stands for. I know a lot of people don't know what the acronym is, so I'll let you bring up that the medical leave, but the act itself. And then also, please add on to anything that Jamie has stated, but also if you could just share with us a little bit about FMLA and you know, before and now after COVID, and are we, how does an employer know when to switch and when not, and can they do what they're typically doing and that stuff? So Jean, if you would please take it away.
Sure. Yes. So FMLA basically stands for Family Medical Leave Act. It's been in place for a while. What it basically does is it protects an employee's medical information. You know, if they have a medical status that keeps them out of work or requires them to have a you know, a staggered schedule or whatever it may be, this leave protects that information from it being communicated or used in any kind of discriminatory way. People that you know, they've worked in the workforce for a while have heard it in new employee orientations or through their policy handbook in the past, but things are changing. With COVID-19, there's been some updates like Jamie just mentioned, and I think going into the future with this COVID-19 situation, we're going to see changes to a lot of legislation, whether it's through benefits like FMLA, being expanded for different reasons other than those that were identified, in the original law. But even things like time worked, schedules, you're going to see staggered schedules so that people aren't all in the workplace at the same time. Options to work from home. I think what we're seeing right now is that employers are realizing that, for a long time, this has really been a question about work-life balance, allowing people to work remotely from home. And I think this has provided an opportunity for employers to see that, production may remain at the same level or even have gone up. I know for myself at home, my wife and I, sit across the dining room table from each other, and we are at it for 8 hours, 9 hours a day straight. And we both said that it seems like we're actually working harder sitting here at home. But again, I think we're going to see employers recognizing that productivity has not dropped off, and in some cases may have even gone up. And there's going to be more options for people to work remotely and so forth. I also see it from the perspective of the employer. People spend a lot of money to rent office space and provide furniture and a lot of different amenities that employers provide. And if you're spending, I know a little bit about the local real estate market, but commercial real estate for an average size building might be $20,000-$30,000 a month to rent. When you think about that and the amount of money that you can save by employees working from home, these are the types of things that I think are going to come into play. HR employees, HR staff, like I said, they're going to be busy rewriting policies when it comes to leave, when it comes to benefits, when it comes to the way that people work remotely and so forth. And if there's anything that came out of this from a positive standpoint in the workplace, it's that I think it's going to open up more of the work-life balance and allow people to do more from home.
Well, I'm going to not disagree with you on that. I feel like we've never been busier at the Albuquerque Esparto Chamber. We make jokes all the time. The La Noche Encantada Gala is our busiest time of year. It takes many little elves and lots of time to put that together. And I did make a comment to the boss the other day. I said, well, I think I might take 10 galas over this because it has been extremely busy. And, that's what we're here for. We're here to provide those resources and those connections that these small businesses need right now. And sometimes it's difficult because sometimes they need something very specific that we're not experts in, and so that was the purpose of doing this. So I really appreciate that. I want to stick with Jean here for a minute, and I want to jump outside of FMLA. And what I really want to know is from an HR perspective, from the perspective of an employer to an employee right now, what are some of the other things that they need to be considering during this time? I know that FMLA is important, especially because there's a lot of people right now working on either remotely or needing to take the time off because of the situation with kids and everything. But we also have other checklists, bullet points, check off a checklist that come with HR that I think some employers probably need to know. What are some of those?
And as an HR professional, our jobs are to support, staff and leadership. And I think, right now working remotely, this has been different for the majority of the workforce. So from a leadership perspective, I think what you need to do is you need to start by communicating frequently, making sure that you're having at least daily check-ins with your staff, giving periodic updates, letting employees know that you're keeping up on the national developments and changes in laws and opportunities for them to use some of the resources that are available. Again, you also, your employees look to you for leadership. So you want to be able to provide information on COVID-19. They're relying on you to provide information on, what they should do if they are feeling sick, or if a family member, comes down with the virus. What is it going to be like when we come back to the office? What kind of safety protocols are going to be in place? These are the things that you want to communicate to your employees, and let them know that you're on top of this, that they're relying on you to be that resource. I think you're also going to see employees that are very concerned about the situation, very, very, they may be scared or anxious to go back to work, not wanting to get sick. So, I think you have to empathize and listen to them. Let employees know that their concerns are normal, and that you want to hear them. Give them several channels to voice these concerns, whether it's through anonymous means, or in meetings that they're having online, whatever it may be. But make sure you listen openly, and don't react defensively if there's things that don't kind of align with what you're thinking from a reintegration standpoint. Most employees just want to feel heard, and not stonewalled by policy language. So just be sensitive to that. I think, we talked a little bit about some of the changes that have come into play with FMLA and leave and so forth. And I think you want to remind employees about all these available benefits. You want to make sure, again, that you provide this information, that they feel that they have a resource to get the information from. It's all over the internet. It's on every news story that you watch. Again, they're looking for you for that information. If your system or your health benefits allow for things like telehealth programs, communicate that to them. Those are the things that people are looking for, for information on right now, because a lot of them don't even realize, telehealth is something that's in most major health plans right now, but a lot of people don't realize that because they've never used it. And now's the perfect time to take advantage of something like that. Even things like flu shots. Flu shots in your health plan are usually free, and I know that, again, maybe it doesn't stop the COVID-19 infection, but it can help you and family members from developing respiratory issues that are a common case of the flu. Again, supporting those at the workplace. You may have employees that are identified as essential workers. Be vigilant in showing your appreciation for them being there, and making sure that you are providing them with the best PPE and safety and cleaning practices around, so that they feel safe in the job. Because what you do now for those employees is going to play big into the way it kind of rolls out when the majority of your staff goes back to work. Be generous where possible. Not every request that you get can be honored. You have to run the business, and you have to do what's best for the majority of the workforce. But if little things like if an employee wants to wear a mask to work, and they feel comfortable with that, let them do that. If they want to telecommute for a while to kind of ease into things, I would recommend that you also, take that into consideration, and do what you can to kind of find, a medium ground there. And then lastly, try to be creative with time, flexible scheduling, alternative work weeks, staggered shifts, rotating telecommuting weeks, things like that, that maybe you shied away from in the past. I think that's going to be the wave of the future, and it's something that people are going to be looking for. And if you haven't already thought about it, you're probably behind the curve, because those are the questions you're going to be getting from employees.
So I think to sum things up, what I'm understanding is that, first and foremost, if you are a small business owner out there and you did not previously have an HR plan in place, take this time. I know we're as busy as we've ever been, but we also have a few minutes to kind of get ourselves organized. So I think it's going to be important that you take advantage of some of the resources that Jamie spoke about, and we'll have that available to you guys as well. But let's get a plan in place. If you don't have anybody to help you, I know that Gene and his team down at Valiant would be happy to get you started. I also know that Jamie mentioned getting with your attorney is a great way to start to make sure you're following within those legal lines of everything. That's super important. And it's also important because you're going to need it moving forward. You know, this is a learning curve for all of us, a quick learning curve for all of us. So I think that's important. I also love what Jean stated about communication and how we communicate moving forward. I think for any small business owner, whether you have HR, a department or not, maybe you're a solopreneur, you only have one employee, how you communicate with your clientele moving forward is really going to be what separates businesses out moving forward. So I think whether it's webinars or Zoom type stuff, Skype, Microsoft meetups, Google Hangouts, all the different ways that people are communicating these days, really opens the doors to things that we had never done before. And I also think it's a time saver, you know, saving on that travel and still getting the information as efficiently across to the public as possible. So I think that those are important that we're sharing with our employees on communication moving forward. Do you have any final advice? I'll ask Jean for employees and Jamie for employers. Do you have any final advice, maybe words of wisdom or something that you could say about how employers should ask of and what they should ask of their employees, and the same for Jamie, the opposite way? You know, we need to make sure that we are compassionate in how we do things, but also that we know how to draw the line to some things. So what can an employer and an employee, so Jean, maybe we can start with you with employees. How can they approach their employer, and what are some of the things that we need to be cognizant of?
Well, like I mentioned before, I think more than ever, employers have to be sensitive and listen to employee concerns. So if there's something on your mind, if there's, you know, if you're not wanting to go back because you're scared about contracting the virus, or you really like working from home now remotely, you know, bring that up in conversation. But back it up with numbers. If you're wanting to work from home, you know, show that your productivity has gone up. Provide something to the employer that's going to be, you know, somewhat of a trade-off. So, you know, maybe you're able to work in the office on certain days or certain peak hours, and approach it that way so that it's a win-win situation. But don't hesitate to bring your concerns to the table. Like I said, now more than ever is that time. And I think that employers are going to listen even more than they ever have, you know, up to this point in time.
Great, thank you. Jamie, for employers that need to approach their employees on sensitive issues or maybe concerns of, we got to put a limit on this. So how do we do that?
Well, first, I want to say that I think Jean summed it up perfectly as far as communicate to the extent you can. Let your employees know what information you have. And I know that right now with COVID-19, there's a lot of unknown. And it's okay to say that, you know, say, maybe we haven't given an update, but we just want to say we're waiting for more information. We don't know, but we'll try and get your answers. And one thing, it's the lawyer in me coming out, is when you want to talk to your employees about perhaps sensitive things, especially health-wise, just make sure that you are doing that within your HIPAA guidelines. And it's communication, whether it be inside your organization with your employees or outside with your accountant, with your lawyer, with your consultant for HR. I think the more you are looking for that advice, the better off that you're going to be. And really, it is better late than never, because how you said, a lot of employers maybe have not put an HR plan in place, but it really is a case of better late than never. Just be there for your employees what you can. And when they do come to you with those questions, like Gina was saying, do your best to get them the answer as soon as you can. And, you know, we're all kind of working in a different time right now. So
We are. Well, it sounds like we've got a lot to take away from this conversation with you guys. It's important that we are being sensitive, I think, not just to our employees and our employers, but also to the community at this time, and understanding that everybody is going through this differently. Some people are affected greatly, some are not, and how we understand each other is how we're going to get through this. And so I think that the information that an employee and an employer can, working together, it can really solve a lot of the problems moving forward, and really help to get the businesses regenerated and reinvigorated, because we're hoping to open back up as the economy starts to move again. And having that, I think, close-knit communication is going to be the key. So I just want to say thank you to you guys so much. So many great ideas and lots of good information. And to everybody out there watching, we'll have Jamie's really, it was a PowerPoint, I believe. It was just, it had a lot of information. I was skimming through it and taking some notes. But I think that if you guys have any questions, you know how to reach us here at the Albuquerque Hispano Chamber. That's www.ahcnm.org. You can email me directly, shannon@ahcnm.org. I want to thank Square and our partners up in the Bay Area, and I want to thank New Mexico Tech as always. Liam, thank you so much for being Johnny on the spot these days. We're all working through this technology, which is a whole nother webinar in itself. And I want to say thank you to Jean and Jamie for joining us. And tomorrow we will be talking about non-traditional types of loans and types of funding that are not federally backed, and maybe you didn't even know existed, I think is what we want to talk about. And that'll be tomorrow at noon, same place, same time. So grab a sack lunch and join us then. And again, thank you to you guys. We appreciate you. And we'll be reaching out if anybody reaches out with questions. Have a great day, everybody.